It's really nice to be invited. The last APPC I went to was 2015 at the University of Adelaide. I was a PhD student and I was helping to organise it, so it's really nice to be invited to give a keynote. Hope you've all been having a good conference. Now, I'm not a Zoom wizard. I'm going to start trying to share my screen so you can see my slides and let me know if it all goes catastrophically. Okay, share. And here's my slideshow. Is this all working okay?
Yep.
Fantastic. And I'm going to try and talk for no more than 40 minutes because I want to leave at least 15 minutes for questions. So could somebody just give me a 5-minute warning when I hit the 35-minute mark?
Sure, sounds good.
Brilliant, thanks. Okay, cool. So we're going to start with a story, and the genre of the story is one which might be quite familiar to some of you. So I want to start by acknowledging Frank Jackson for pioneering this particular genre of philosophical fable, and Miri al-Bahari, who happens to be with us right now, for continuing it and giving me the inspiration to also plagiarize Frank Jackson. And the story comes from chapter 8 of this book, which is going to be out next year. So that's my little advertisement. So if you want to hear the story in more detail than I have time to tell it in today, that's where to go and look for it. But the story goes like this, right? You have a friend whose name is Maria for various reasons, and she's an expert in the mind and brain sciences. In particular, she's thoroughly conversant with the academic literature on the class of drugs called classic psychedelics, also known as serotonergic hallucinogens. So she knows a number of facts about this class of psychoactive substances. She knows that the most famous examples of this class are LSD, mescaline, psilocybin, and DMT. She knows that these drugs can cause profound and dramatic changes to perception, emotion, cognition, the experiences of space and time, and the sense of self. She knows that their effects on consciousness, the effects that these drugs have on experience, are highly variable, far more variable than the effects of other psychoactive substances, and are strongly influenced not just by the drug itself and the dosage, but by what's known as set and setting, so the psychological state of the individual taking the drug and the physical and social environment in which they take it. She knows that they cause these dramatic effects on consciousness mainly by stimulating the 5-HT2A, otherwise known as the serotonin 2A receptor in the brain, and that they in fact have different pharmacological mechanisms and different experiential effects from a bunch of other drugs that sometimes loosely get called psychedelics. So you have drugs like ketamine, which is a dissociative anesthetic, cannabis, entactogens like MDMA, weird outliers like salvia divinorum, and all of these have been called psychedelic, but they don't actually belong to this class of classic psychedelics or serotonergic hallucinogens, which is Maria's primary interest in the mind and brain sciences. She knows that classic psychedelics were studied as experimental psychiatric treatments for a range of psychological ailments back in the 1950s and 60s before they became controversial and were prohibited. And she knows that since the 1990s, there's been a new wave of rigorous scientific research into these compounds that's shown, contrary to popular belief, that they can actually be administered safely in carefully controlled conditions if due caution is taken to suitably prepared and suitably screened volunteers. And this encompasses both healthy subjects without a psychiatric diagnosis and patients with a diagnosis of anxiety, depression, or substance use disorder. And most remarkably, or maybe not most remarkably, but remarkably, Maria knows that in these trials, it's been found repeatedly that 1 or 2 controlled psychedelic experiences conducted in this fashion can lead to lasting psychological benefits, either to reductions in psychiatric symptoms or in healthy volunteers to increases in self-reported well-being, lasting months or even years after just 1 or 2 sessions on the drug. And she also knows that these kinds of lasting psychological benefits across different populations and different trials, whether it's psychiatric symptom reduction or increases in well-being, across the board, they seem to be predicted by the occurrence of a specific type of experience during the drug effects, the so-called mystical type experience. So people report this transcendent experience of oneness or cosmic unity in which the ordinary sense of being a separate self is lost. And it seems to be when this kind of experience occurs that these lasting psychological benefits actually result. Other people who receive the same dose of the drug but don't have the mystical type experience don't seem to have the same lasting psychological benefits. Maria also knows that a bunch of neuroimaging studies have started to shed light on the neural correlates and underlying mechanisms of these effects. In particular, a lot of studies have shown that psychedelics seem to disrupt the functioning and the integrity of certain large-scale brain networks, including the famous default mode network, which tends to be most active either when we're doing self-referential cognitive tasks, reflecting on our own identity and autobiography, or when we're in the kind of task-free default mode of just resting, not doing anything in particular. But here's the kicker, which a lot of you can probably already see coming. Despite this wealth of academic expertise on classic psychedelics, Maria herself has never taken a psychedelic. She's accepted as a volunteer in a scientific study of psilocybin. She goes in after the thorough preparation and so on. She has the supervised psilocybin experience. Psilocybin is the active chemical in magic mushrooms, by the way. And then talking to you the day after the experience, Maria claims not only to have had a very interesting experience, but to have gained significant epistemic benefits from it. And the philosophical question that we want to address is, well, has she? Is this claim correct? Is it plausible? If so, what kinds of epistemic benefits has she gained and how has she gained them? So that's the basic setup. Now, her claim to have gained significant epistemic benefits by taking a psychedelic or so-called hallucinogenic drug is likely to provoke considerable skepticism, especially, I think, among a crowd like this. And being philosophers, some of you might already, in the back of your mind, more or less explicitly be formulating arguments for the falsity of her claim, right? You might be thinking there are reasons why it can't possibly be true, or at least it's implausible in the extreme, that Maria has in fact gained significant epistemic benefits by taking a psychedelic drug. And here's how one such argument might go, right? We can call it the argument from drug use. It says psychedelics are drugs. It's impossible to gain epistemic benefits by taking a drug. Therefore, it's impossible to gain epistemic benefits by taking psychedelics. Well, the argument's valid. It's a nice, clearly valid syllogism, but I want to put it to you that it's unsound because premise 2 is patently false, right? So to see this, you only need to think about the old saw that a mathematician is a device for turning coffee into theorems, or to think about the widespread use of pharmacological cognitive enhancement among various populations, notably university students. Or you can think about, you know, the several coffees per day without which many of us would not get as much academic work done as we do. You can think about the debates about the ethics of pharmacological cognitive enhancement, in which its possibility and efficacy is taken for granted, right? So I think it clearly is possible to gain significant epistemic benefits by the judicious ingestion of psychoactive substances. This argument is a non-starter. Of course, whether psychedelics are among those substances remains to be seen. But the point in my view is that the issue can't be decided merely by noting that they are psychoactive substances. So I think that one attempt to show in the abstract that Maria's claim can't possibly be true does not work. So let's have another try. Here's another possible argument that you might make for the falsity of her claim. We can call this the argument from impairment. And it says, look, psychedelics, these drugs impair the mechanisms whereby the brain, in its ordinary, sober, non-intoxicated condition, generates accurate representations of reality. Premise 2, it's impossible to gain epistemic benefits by impairing the mechanisms whereby the brain generates accurate representations of reality. Well, that sounds plausible. Therefore, conclusion, it's impossible to gain epistemic benefits by taking psychedelics. Well, the argument looks valid on the face of it, but premise 1 is ambiguous, right? This premise, it says psychedelics impair the mechanisms whereby the brain generates accurate representations of reality. Here's a strong reading of that premise. This is their only effect, right? The only thing that psychedelics do is to impair the mechanisms whereby the brain generates accurate representations of reality. But I think it's pretty clear that on that strong interpretation, this premise begs the question against Maria, right? So she's an academic expert on psychedelics. She knows that they have some epistemically detrimental effects. She knows, for instance, they can cause people to misperceive spatial distances and temporal durations. She knows they can cause people to see actually stationary objects as moving, and so on, right? But she's claiming that in addition to their undeniably epistemically detrimental effects, they also have other epistemically beneficial effects, right? And so to claim that impairing the mechanisms whereby the brain generates accurate representations of reality is their only effect, they have no epistemically beneficial effects, is to beg the question against her. On the other hand, if you go for a weaker reading of that premise, which says this is just one of the things that psychedelics do, then the argument becomes clearly invalid, right? It becomes analogous to the following obviously invalid argument, which I like to call the argument from Vindaloo, which says eating Vindaloo stimulates capsicum receptors. So these receptors are stimulated by chili and other spicy things that give you the sensation of spiciness, of hotness. It's impossible to nourish oneself by stimulating capsicum receptors. Therefore, it's impossible to nourish oneself by eating Vindaloo. Well, clearly invalid, and I think exposes the invalidity in the argument from impairment if the first premise is understood in the weaker sense. So the point, obviously, is the fact that some of psychedelics' effects are epistemically detrimental doesn't show that they all are. At best, it establishes a prima facie presumption, but it's still consistent with the hypothesis that some of their effects are, in fact, epistemically neutral or even epistemically beneficial. So there are other arguments, and I'd be interested if anyone wants to hazard any others in Q&A, but from examining those two attempts to show in the abstract that Maria's claim is false, the moral I draw is that the question can't be evaluated in the abstract, right? There's no master argument that shows either the actuality or the unactuality of psychedelic-facilitated epistemic benefit. So to decide whether her claim is plausible or not, we just need more information, right? We need more detail about the specific type or types of epistemic benefits that she's talking about. So what are some possibilities? Well, there are 5, and in the chapter of the book from which this paper is drawn, I go through all of them, and I think all of them are in fact plausible in light of what we know about psychedelics. So there's propositional knowledge or knowledge that, ability knowledge or knowledge how, knowledge by acquaintance, new knowledge of old facts. You can see, obviously, those of you who know the debate over Jackson's argument, Mary's Room, this is drawn very directly from that debate, except I'm saying that I'm not opting for one answer or the other, I'm saying that all the answers are correct. And finally, there are indirect epistemic benefits that might come not from the psychedelic experience itself, but from its lasting psychological consequences. Now, in this talk, we're going to have at most time to get through the first 3 of these. We may only get through the first 2, so we'll see how we go. We'll at least do knowledge that and knowledge how, and hopefully there'll be time for a quick bit of knowledge by acquaintance at the end. So let's look at the options for knowledge that, or propositional knowledge. So it's not uncommon at all for subjects or patients who receive psychedelics at moderate to high doses to claim they've gained some kind of propositional knowledge from the experience, to come out on the other side and claim that they've learned some new fact about the world, something that is objectively true, some state of affairs that really obtains. So here's one representative example of a psychedelic subject claiming propositional knowledge gain. This comes from a patient in the 1970s who had a diagnosis of a terminal illness and received psychotherapy assisted by the psychedelic drug DPT, dipropyltryptamine, and this is psychotherapy for the anxiety and depression and existential distress that attends a diagnosis of a terminal illness. And in fact, incidentally, this is the most rigorously studied, the kind of best evidentially supported application for psychedelics as therapeutic agents in the recent wave of research is as kind of a treatment for anxiety, depression, and existential distress in people with a terminal illness. But there was already research on this back in the 70s, and so this patient who received DPT had the following to say about his experience. I seemed to transcend time and space, and I lost complete identification with the real world. The experience seemed to me to be as if I was going from this world back to another world before this life occurred. When I was there, everything seemed to make sense. It was a very beautiful world, one in which love was very much a part. The basic theme that I perceived was that life continues to go on, presumably after death, I think he means, and we are basically some form of essence from a supreme being, and we are part of that supreme being. The results of the use of the hallucinogenic drug on my life have been very profound. I seem to have a much deeper understanding of life and death. I don't have the fear of death that I once had. I have found that everyday living seems to be much more enjoyable. I am a much more content individual, having had the great opportunity to just glimpse for a very short moment the overall thinking of God, to be reassured that there is a very beautiful, loving, masterful plan in this universe for all of us. So that's one type of propositional knowledge that people often claim to have gained from their psychedelic experiences, knowledge of propositions like there is a very beautiful, loving, masterful plan in this universe for all of us, or propositions like we are some form of essence from a supreme being, or life goes on after death. But interestingly, Maria is not making any claims to have gained knowledge of propositions of that sort, right? Propositions which we might, in a broad brush fashion, describe as non-naturalistic. So like the journalist Michael Pollan, who wrote a best-selling book on psychedelics 2 years ago and had a number of psychedelic experiences himself as part of the research, Maria was a naturalist and an atheist before her psychedelic experience, and she remains one after it, right? She hasn't come to believe in anything non-naturalistic or supernatural from a metaphysical standpoint. She might even issue to you disclaimers in the conversation. She might say similar things to some of Michael Pollan's disclaimers. He says, "Nothing in my psychedelic experience led me to believe this novel form of consciousness originated outside me. It seems just as plausible and surely more parsimonious to assume it was a product of my brain." I could easily confirm, he's talking here now about some of the psychometric criteria for the occurrence of a mystical type experience. He says, I could easily confirm the fusion of my personal self into a larger whole, so that's the sense of oneness or interconnectedness, as well as the feeling that I experienced something profoundly sacred and holy, provided that is my endorsement of those loaded adjectives doesn't imply any belief in a supernatural reality. The experience brought me no closer to a belief in God or in a cosmic form of consciousness or in anything magical at all. So this is interesting, right? What's happening here is Maria is claiming to have gained from her psychedelic experience significant epistemic benefits that are consistent with a naturalistic worldview. So not epistemic benefits such as propositional knowledge about the existence of God or a spirit realm or an afterlife. So what are some possibilities within this naturalistic constraint? Well, staying for now on the first option, knowledge that, or propositional knowledge, there's another type of propositional knowledge that subjects often claim to gain, and this is psychodynamic insight, so a newfound awareness of one's previously unconscious or otherwise previously unknown mental states. And so here's an example from a recent clinical trial, which is fairly typical and representative. This was a patient with treatment-resistant depression who received psilocybin treatment. And he was talking about his experience and said, during the psilocybin experience, I became myself at age 7 after my grandparent had died. I totally was back there, so vivid, so real. I had the emotions that I would have felt at the time. Fearful, why did this happen? The naivety, the shock and confusion. I was getting overly upset and my parents were saying, boys don't cry. Now, according to the authors of this qualitative study, this helped the patient realize how his unhealthy emotional habits as an adult, presumably that had been causally implicated in his depression, developed. And he said, I saw in the experience, in the psilocybin experience, I saw that it's not a weakness to be emotional. That's an unhealthy attitude. So what seems to have happened here, if we take it at face value, is this patient has emerged from his psilocybin experience with a new justified true belief, or something like it, right? What belief? Well, we could gloss it as something like the belief that his unhealthy emotional habits as an adult, habits of avoidance, repression, and so on, were caused, at least in part, by the childhood internalization of unhealthy emotional attitudes conveyed to him by his parents, attitudes such as boys don't cry. So on the face of it, this is what seems to have happened. But the question we're going to ask, of course, as philosophers is, well, is this patient's belief really both true and justified? Well, obviously, determining its truth in any sort of conclusive way is going to be difficult in a lot of cases, right? In many cases, there's just going to be no source of independent evidence that we can appeal to really verify whether the patient's kind of causal psychodynamic insights about their own psychology are correct. But assuming that such insights are true in a lot of cases, another question is, well, does the patient have significant justification, sufficient justification? So does this patient coming out of the psilocybin experience have adequate evidence or adequate reasons for believing that this apparent insight is in fact genuine or veridical? And I want to say not based on the psychedelic experience alone, right? So even if the putative insight is accompanied by an overwhelming feeling of rightness, or what's sometimes called in psychology, the feeling of knowing, and even if it could be shown rigorously that this insight contributes causally to reductions in depressive symptoms or other clinical benefits, the insight still might be inaccurate, right? It still might be false or misleading or confabulatory in some way. So David Joplin has pointed out the possibility of this sort of thing, and he coined the term placebo insights to talk about this kind of phenomenon that can happen in insight-oriented psychotherapy. And he says, look, the mere acquisition of apparent insight is not a guarantee that the insight is true. The client's level of conviction about the validity and authenticity of a newly won insight is not a guarantee that the insight is true. The therapist's conviction about the authenticity and the truth value of the insight is not a guarantee that it's true. And even the occurrence of therapeutic change, right? Even the fact that the putative insight is demonstrably psychologically beneficial is not a guarantee that the insight is true. So how to sort the wheat from the chaff, right? On the assumption that psychedelics probably sometimes lead to genuine psychodynamic insights, but probably sometimes lead to psychologically beneficial false insights, what can one do? Well, one possibility is to appeal to theoretical grounds, right? So you might say there are things that we know about how psychedelics work on the brain and how they affect the mind that suggests that apparent psychodynamic insights they induce are especially likely to be accurate most of the time. As it happens, I think there are such grounds. I don't have time to talk about them now. I can go into them in Q&A if people want. I think there are grounds for tentatively concluding that very many of these sorts of insights are likely to be accurate. But I think these grounds are tentative, they're inconclusive, and they don't support, even if the argument works, it still doesn't support the conclusion that all apparent insights are going to be accurate, right? It's just a majority of them. There are still sometimes going to be placebo insights. So the most obvious solution, I think, is to just, it's kind of boring, humdrum and prosaic, but it's just to say that, look, as with any other insight-oriented therapy, the patient and the therapist together need to scrutinize putative insights for plausibility in the post-session period, right? So every time someone has a guided supervised psychedelic session, they always will have several what are called integration sessions with the therapist afterwards to talk through what happened in the experience and any lessons gleaned from it. And that clearly is the time for the patient and therapist together to look at these putative insights and try and figure out which of them really are true, which of them really are accurate, which of them really are useful. And I think it's entirely likely that the outcome of that process is often going to be something like a justified true belief, right? That once the patient has kind of scrutinized the putative insight in the ordinary sober state and kind of assessed its coherence with all of her other kind of sources of knowledge and forms of reason and so on, very often that process is going to end up conferring sufficient epistemic justification for accepting the insight. So my conclusion then, when it comes to propositional knowledge, is that genuine psychodynamic insights, so real propositional knowledge about one's own mind, often are acquired not via psychedelic experience alone, but via psychedelic experience and subsequent disciplined, critical, sober reflection on it. So that whole process can lead to propositional knowledge gain. I'm just going to see how I'm going for time. Oh, I'm going okay, good. We'll probably even get through all three kinds of epistemic benefits. Go back to sharing. From current slide. Okay, so propositional knowledge, of course, is not the only kind of knowledge Maria might claim to have gained. Another possibility is knowledge how, or ability knowledge. So here are some reports from psychedelic subjects that hint at the idea that some kind of knowledge how might actually be gained through psychedelic experiences. So the first one is from the same cohort as the last patient. So this is another patient who received psilocybin for treatment-resistant depression, and said afterwards, in the experience, in the psilocybin experience, I saw negative patterns in my life where if something bad happens, I used to just put it to the back of my mind. Afterwards, after the experience, the psilocybin treatment, I allowed myself to experience everything, even if it is sadness. Now I know how to deal with my feelings rather than repress them. Right, so obviously I've highlighted the wording there because this patient is precisely describing learning how to do something, how to deal with their feelings. Here's another example, another patient from the same cohort, which doesn't use quite such precise language, but I think is still clearly getting at the same sort of thing. I took away from the experience that I used to get angry about having anxiety. Now I think I can have the anxiety. I can just feel it and it will go. I don't have to have the fear or run away. Right? So again, it seems pretty clear that this patient is describing learning something about how to deal with their difficult emotional states from the experience induced by psilocybin. And here's a report from a healthy volunteer, so someone without a psychiatric diagnosis who received multiple doses of psilocybin in a trial in the early 2000s. And she's describing her third session. She says, look, in my third psilocybin session, there was a familiarity to this inner space, and I found I was able to navigate much more easily than during the previous sessions. I felt no fear and was able to keep an even keel emotionally and psychologically, and to largely maintain the role of observer. And again, I've highlighted the language that I find highly suggestive. She says, I told one of the supervising therapists it was like learning to ride a bicycle and leaning into the turns. Of course, learning to ride a bicycle is one of these cliched examples that we philosophers like to give of what we're talking about when we talk about knowledge how. So if people are getting out of their psilocybin experiences something that is analogous in important respects to learning how to ride a bicycle, well, it seems pretty open and shut that they're getting some kind of knowledge how. But what sort of knowledge how, right? What exactly are people learning how to do from their psychedelic experiences? And I offered a bit of a hint before. I talked about learning to deal with their emotions, which obviously is what the patients with depression were talking about. But there's quantitative evidence that speaks to this question, right? There's a body of research, a bunch of studies that have come out in the last few years showing that psychedelic experiences, in some cases a single psychedelic experience, can durably increase mindfulness-related capacities. So I'm just going to give you a really inadequate potted summary of mindfulness meditation. So mindfulness meditation, also known as Vipassana or insight meditation, is a practice drawn from the Buddhist tradition. And it starts with developing the ability to concentrate, so developing a degree of meditative concentration by giving focused attention to some sensory stimulus, such as the sensation of the breath or sensations in the body, and practicing bringing attention back again and again to this meditation object whenever it wanders off into thoughts and emotions and daydreams. Then once a certain degree of meditative concentration has been developed, the practitioner engages in what's called open monitoring, right? So not really attempting to direct or focus attention, but just allowing whatever passes through the mind to pass through it and paying a kind of open, receptive, alert attention to whatever happens in the mind, be it thoughts, daydreams, sensory stimuli, physical sensations, emotions, whatever, just attending to the passing contents of consciousness in an open, curious, non-reactive way. So practicing this ability to just watch the contents of consciousness, thoughts and feelings, and see them as just thoughts and feelings passing through the mind, and not kind of get caught up in them, not feel compelled to chase them or pursue them or become emotionally invested in them. Now, interestingly, psychologists have developed, so obviously the science of meditation and mindfulness is big business. This has become a really booming research area in the last couple of decades. And psychologists have developed psychometric measures, so various scales and questionnaires for quantifying these mindfulness-related capacities. And they've been shown to be sensitive, as you'd expect, to the effects of mindfulness meditation practice and standardized mindfulness courses. So they measure such skills as awareness, right? So being able to remain aware of what passes through the mind without distraction, non-judging, non-reaction, so the ability to maintain a kind of even, non-judgmental, non-reactive awareness of what's going on in the mind. And as I say, some of these have been really well validated empirically. They've been shown to be sensitive to the effects of different forms of mindfulness training and so on. And interestingly, there's now a considerable body of evidence showing that a single experience on psychedelics, on psilocybin or ayahuasca, can actually elevate these measures of mindfulness related capacities for as much as 2 or even 3 months, right? So not all of these references show that. Some of them have only done follow-ups at 1 or 2 weeks, but all of them have essentially shown increases in mindfulness capacities outlasting the psychedelic experience itself, lasting beyond the drug effects. And in a couple of them, it's been shown that these measures stay elevated for 2 or 3 months after a single experience. There's also a couple of studies showing that psilocybin can increase the beneficial psychosocial effects of meditation practice. So if you have 2 groups of people practicing meditation, one group receives psilocybin and the other group receives a placebo, you know, they have a session at some point during their ongoing practice of meditation, then the beneficial psychological effects of the meditation practice are magnified in the group that has the psilocybin experience. So, and finally, really interesting finding that if you get meditators, experienced meditators on a silent group retreat, right, following their normal Zen meditation routine. And then on day 4 of the 5-day retreat, one group receives a psilocybin pill and the other group receives a placebo, and they continue to go about their normal Zen meditation routine in the retreat setting. Well, then after the retreat, you measure them on various indices of mindfulness related capacities. You get them to do some meditation in the neuroimaging scanner, and it turns out that the ones who had the psilocybin capsule rather than the placebo show a greater ability when they're practicing this open awareness meditation to actually down regulate or disintegrate the default mode network, so this brain system that's implicated in self-referential thought and mind wandering and so on. So I know I'm going through this quickly. I can go into this stuff in more detail in Q&A, but point is there's just a large body of evidence that is highly suggestive of the idea that psychedelic experiences can increase people's capacities to do the kinds of cognitive and attentional things that people practice doing in mindfulness meditation training. So here's an argument that I call the argument for mindfulness capacities. Premise 1, the sorts of attentional skills cultivated in mindfulness meditation, so these skills for awareness, acceptance, non-reaction, and non-judging, amount to a kind of knowledge how, right? I'd be interested to hear if anyone dissents from that. To me, that seems pretty plausible conceptually. Premise 2, psychedelic intake reliably facilitates the acquisition or increase of the sorts of attentional skills cultivated in mindfulness meditation, and that's supposed to be just a summary of the empirical literature, the findings I've just been citing. Therefore, conclusion, psychedelic intake reliably facilitates the acquisition or increase of a kind of knowledge how. So that's a second type of epistemic benefit consistent with naturalism that Maria might claim plausibly to have gained from her psilocybin experience. Okay, a third one, and do I have time? Yeah, I've got time, fantastic. Okay, so another thing that is common is for subjects to claim that while on psychedelics, while under the influence of these drugs, they came to know certain facts more directly or with greater certainty than they could do in the ordinary sober state. And so here are some examples from the classical research that took place back in the 1950s and 60s. So there was one case in which a mentally healthy volunteer, someone without a psychiatric diagnosis, an assistant professor of English literature, had never had psychedelics before and was administered peyote, a cactus which contains the classic psychedelic mescaline. And he claimed that the most important outcome, if he had a very rich, rewarding, interesting experience, mescaline lasts for about 12 to 14 hours, so he was just in this farmhouse under supervision all day having these incredible experiences. And afterwards he claimed that the most important outcome of his experience was, in his words, the knowledge and certainty I now have that it is truly possible to attain to a sense of harmony with all creatures and things. And so his wording is very important there, right? Because he had, obviously, while he was on mescaline, he had this incredible experience of a sense of harmony, of feeling totally in harmony with all creatures and all things. But afterwards, what he's saying is, well, what's really important about that is that I now know for a certainty that that is truly possible, right? I know that attaining to that sense of harmony is something that is really possible, that humans can really experience, and moreover, that I can really experience. And so that fact, the fact that he's emphasizing certain or direct knowledge about what's possible, is going to become important, right? Apparently, terminally ill patients who receive psychedelic-assisted treatment for anxiety, depression, existential distress also experience similar revelations, right? So this is not a direct quote from a patient, but this is a quote from Walter Pahnke, a researcher who I believe was a therapist who attended many of these sessions with people having LSD when they were terminally ill. And he said at this point, at the point of reaching a kind of mystical breakthrough or an experience of ego dissolution under the drug, unless the patient previously had experienced mystical consciousness spontaneously, he becomes intensely aware of completely new dimensions of experience which he might never before have imagined possible. From his own personal experience, he now knows that there is more to the potential range of human consciousness than we ordinarily realize. This profound and awe-inspiring insight sometimes is experienced as if a veil had been lifted and can transform attitudes and behavior. So I think that what these patients are saying and what Walter Pahnke is saying in that quote is very reminiscent of Russell's notion of knowledge by acquaintance, this kind of direct, unmediated knowledge, knowing something firsthand that is supposed to contrast intuitively with sort of indirect knowledge by mere description that you can get from testimony, from reading books and so on. There are some problems with Russell's account, right? In particular, the insistence that knowledge by acquaintance is unmediated and non-representational. So on certain views of mind and cognition, including mine, this doesn't really make a lot of sense because knowledge is intrinsically, essentially representational through and through. So here I just adopt a weaker definition that's given by Earl Coney in the debate over Jackson's argument. And Coney says, look, knowledge by acquaintance just amounts to being familiar with the known entity in the most direct way that it's possible for a person to be aware of that thing, right? So it doesn't need to be totally direct, unmediated. It can still be representational. As long as it's maximally direct familiarity, then it counts as knowledge by acquaintance. And so I'm going to give a brief argument that psychedelics facilitate the acquisition of knowledge by acquaintance, so maximally direct cognitive familiarity with certain important facts. It goes like this. Premise one, Coney's definition, knowledge by acquaintance is maximally direct familiarity, right? Premise two, there are important facts that psychedelic experience reliably facilitates the acquisition of maximally direct familiarity with. Therefore, conclusion, there are important facts that psychedelic experience facilitates the acquisition of knowledge by acquaintance with. So obviously now the question is, what facts and how does it work? Am I still okay for time, by the way? Have I still got a few minutes?
Yeah, so we got like about 14 left in the session.
Oh, in total?
Yeah, but it's
okay,
not too bad,
right.
so yeah.
All right, I'll try and wrap this up pretty quickly.
We've got about 5 minutes extra as well, so.
Okay, yeah, all right. Look, I'll just go through this really quickly and then if anyone is really interested, I can go back to it. So what sort of facts am I talking about? I'm talking about modal facts, right? I think there are probably more than these, but notably, I think there are two important modal facts about the human mind. So facts to do with possibility, necessity, impossibility, and so on, that psychedelic experience can reliably catalyze the acquisition of knowledge by acquaintance with. And these are the fact that the mind has vast potential that's typically unrealized in the ordinary waking state, and the fact that the ordinary sense of self is contingent and mutable, right? So remember, Pahnke says, look, the psychedelic subject knows from their own experience that there's more to the potential range of human consciousness than we ordinarily realize. And then also subjects who undergo episodes of drug-induced ego dissolution discover that the ordinary, seemingly unproblematic sense of self is in fact not as kind of immediate and unproblematic as it appears. It is in fact highly contingent and constructed, and it's possible for our sense of self to be radically altered, radically diminished, or even controversially perhaps absent from conscious experience entirely. So obviously you can gain knowledge by description with these modal facts, but under psychedelics, I claim that you attain maximally direct familiarity because these modal facts actually become manifest, right? So they're both facts about possibility, right? It's possible for the mind to be many other ways that ordinarily it's not. It's possible for the sense of self to be radically different or to be altered. Well, under psychedelics, very often, both of these possibilities become actualities. And as anyone who knows their modal logic knows, the inference from actuality to possibility is very direct, right? So what is the most direct way in which a mind can become acquainted with, or can kind of, what is the most direct cognitive relation that a mind can enjoy with the fact that something is possible for that very mind itself? Well, I submit that it's for that possibility to be actualized in that very mind itself, right? Clearly, it doesn't get much more direct than that. So I'm just going to skate over the details here. But obviously, my conclusion is there are at least 3 types of significant epistemic benefits consistent with naturalism that Maria might claim plausibly to have gained during her psychedelic experience and its aftermath. So there's psychodynamic insight into her own mind, which is a type of propositional knowledge how to attend to mental contents in non-reactive mindfulness type ways, and knowledge by acquaintance with important modal facts about the mind. As I said, there are other types as well that I haven't had time to go into, but that'll do for now. So thanks.
All right, thank you, Chris, for that talk. So the way we're going to deal with questions, we've still got a pretty good amount of time for questions. So you can use the raise hand feature, and I'll put you down, and then I'll lower people's hands so I can. Actually, there are a lot of questions, so I'll take people's questions and then I'll write it down. And if you notice that your hand's been put down, that means basically that I've taken down your name, basically. So we'll start with Jillian.
Hey, Chris, thanks. That's incredibly interesting. I wanted to ask about some of the first cases of knowledge that you talked about. So I think somebody came to have knowledge that there was a certain pattern in their behavior that was destructive in some way. And you said with sort of rational discussion afterwards, you might come to have knowledge from the psychedelic experience. And I want to know more about the mechanism that makes that possible. Like, what is the drug doing? Like, is it stimulating some part of the brain or shutting down some other part of the brain? Like, how could it work?
I'm so glad you asked, because yeah, that's the perfect question, because that gets to, I said that I do think there are theoretical grounds for thinking that these insights are very often likely to be reliable, and I didn't have time to talk about them. In a nutshell, it goes like this, right? So an influential theory at the moment of how psychedelics work on a cognitive level is based in hierarchical predictive processing. So this theory that the brain maintains a hierarchical inner model of the world, and so at lower levels it's modeling really concrete and abstract, immediate spatiotemporal features, perceptual features, and whatever. At higher levels you have representations of objects, states of affairs, whatever. And right up the top of the hierarchy, and the idea is that this cognitive hierarchy sort of matches the anatomical processing hierarchy of the cortex, you have these really abstract beliefs about, the existence of the self, that I'm something distinct from the rest of the world, maybe even Kantian stuff like space, time, causality, and so on. And the kind of going theory at the moment is what psychedelics do is they actually disintegrate the networks right at the top end of this hierarchy that maintain those really fundamental abstract beliefs about self and world and so on. And so this is why you get this experience of oneness, transcendence of time and space. It's because all those maximally abstract and fundamental assumptions that normally structure the brain's generation of a world model are being relaxed or taken offline, right? But the suggestion is that this could also account for this sort of psychodynamic insight, because let's say I have this self-image, I have this deeply entrenched belief about myself that, I'm a generous person, right? I'm good, I'm selfless, I'm ethical, I like to give to others. Well, on this predictive processing theory, to the extent that you've got a belief that is really deeply entrenched, that the brain has a high level of confidence in, conflicting evidence is just going to be dismissed as noise, right? So it's a Bayesian story. You think about like the hollow mask illusion, wherein if you view a mask of a human face in the, never remember the words, in the concave orientation, it pops out and appears as convex. And the explanation is that, look, the assumption that human faces are convex is so deeply weighted, so heavily weighted by the brain that conflicting sensory evidence is just dismissed as noise. Well, the thought is we can lack self-knowledge because we have deeply entrenched beliefs about the kind of person we are. And so, to take another example, if I'm depressed, I might have this core belief that I am unworthy, right? That I'm just not someone who deserves to have good things happen to them. And the thought is that to the extent that that is a deeply entrenched belief, I'm just going to kind of ignore or dismiss evidence that in fact I am a worthy person, right? The brain is just going to dismiss that as noise in the same way that Hume dismisses testimony about miracles, right? The idea is we've got sufficient evidence for this generalization that we can't trust any evidence that conflicts with it. So the thought is that if this is the true story about cognition, something like this, then obviously these high level models of who we are, although they're incredibly important, we couldn't get by without them, they can also have epistemic costs, right? Because to the extent that we have deeply entrenched beliefs about who we are, that's going to prevent us from accurately apprehending certain facts about our own psychology and personality. And so by taking those high level models and beliefs temporarily offline, psychedelics provide an opportunity for evidence that otherwise would be filtered out or ignored to kind of come into awareness and force an update of those models, which obviously is not always going to lead to accurate or veridical results, but you can see how, based on the theoretical standpoint, you should expect that it would a lot of the time.
Yeah, that's incredibly interesting. Thank you.
Thanks.
So the next question is from Asher.
Hey, so yeah, thank you so much for the talk. I'm really interested in this, and especially actually just with your response to Gillian's question, looking at psychedelics as a potential mode to disrupt the predictive processes of the brain. I think that there's a lot that can be gone into that, and a lot more obviously with the philosophy of psychedelics. But my question has more to do with, I don't know if you're familiar with the philosophy of David Pearce and, you know, his idea of the hedonistic imperative, and he's written a wee bit about engineering psychedelic drugs to, you know, kind of produce a really wide range of qualitative states that encompass, you know, qualia that we can't even imagine, you know, just under our current perceptions of the world and conceptual schemes. And so I was wondering, do you think that future, you know, under a future hypothetical paradigm of psychedelic science, possibly these experiences could be, you know, fine-tuned, or, you know, these drugs could be fine-tuned to elicit only certain types of knowledge that you discussed, and not others? Or do you think that the epistemic benefits that you get from taking psychedelic drugs are inseparable and it's more holistic?
Yeah, that's an excellent question. I kind of think the latter, right? I think, you know, I'm all for this project conducted with sort of due caution and so on, like, why not go for it? But I think from a theoretical standpoint, I think it's likely to have limits, just because I don't think there's, you know, it seems to me like to get the sort of, you know, I need to see more of what Pearce is exactly saying, but I think there are limits to, you know, there's not a one-to-one mapping, obviously, between specific neurotransmitter receptor types and specific cognitive functions, right? So, I mean, there are a lot of, and I always wonder if I'm missing something, but there are so many, you know, psychopharmacology papers that say, look, LSD affects visual perception, social cognition, da-da-da-da-da-da-da-da-da-da-da. And this all shows that the serotonin 2A receptor is involved in all these different cognitive functions. Well, I'm not sure about that inference, right? Because like serotonin 2A receptor stimulation has lots of downstream effects. I don't think that just because a serotonin 2A agonist has an effect, you can conclude that the serotonin 2A receptor is involved in that thing. But anyway, yeah, I mean, you know, yeah, so when it comes to the sort of knowledge I was just talking about in answering Gillian's question, I think that, yeah, there are principled reasons to do with how predictive processing works. So Andy Clark has this line that I quote in the book. He says, prior knowledge in the predictive brain is always both constraining and enabling. And that's why I think that if this is in fact a true picture of how we work, then yeah, the epistemic benefits that you get from relaxing our high level priors or whatever, you're not going to be able to get without also getting the epistemic costs that come from, because the benefits come precisely from relaxing those priors, right? And I don't see in principle how you're going to have another route to those same benefits. But I will mention, by the way, just in terms of fine-tuning these experiences, the very first clinical trial of what's called candy flipping, if anyone knows that term. So that's taking LSD and MDMA together. The very first clinical trial of that has now been registered, and that's supposedly taking place, I think, next year. And part of the rationale there is to see if the entactogenic kind of emotional effects of MDMA can reduce the risk of a bad trip under LSD. So people are pushing the frontier in terms of tailoring and precisifying the experience. Yeah.
Yeah, no, that's really cool. Thank you so much.
Thanks.
So the next question is from Song-Soo.
Hi, thanks for the talk. It's really interesting. And then I have a question about your understanding knowledge by acquaintance. So you quickly mentioned that you don't think that the Russellian understanding of knowledge by acquaintance is legitimate in some sense because it is not representational. And then, so it seems to me that then you are thinking that knowledge by acquaintance is should be representational in some sense. Then my question is this, then what is the difference between knowledge that and knowledge by acquaintance? What is mean by in the most direct way for someone to aware some fact? It seems to me you are thinking that both are representational. Then what's the difference? Yeah.
Sure, yeah, good question. So the difference is really just to do with the length of the causal chain, right? So let's look at the modal fact that my mind has vast, ordinarily unrealized potential. Well, suppose I've never taken psychedelics and I come to know about that fact by reading books by Aldous Huxley and Timothy Leary about the psychedelic state, and then I make some inferences, right? I infer that, oh, because I'm reading these words, probably Huxley and Leary wrote these words, and because they wrote these words, probably their minds have this potential, and because my mind is relevantly similar to their minds, probably my mind has analogous potential. And so I come to gain a justified true belief, but my thought is that, you know, the modal fact itself is a property of my mind. It's sitting here in my head all along, but kind of the causal chain that leads to my acquiring that knowledge is very indirect and circuitous. It runs out. It involves not Russell's head. It involves, well, I guess it indirectly involves Russell's head. It involves Leary's head. It involves Huxley's head. It involves their books. It involves all these inferences. Whereas, you know, if I then go and take LSD and that unrealized potential of my mind becomes manifest in my mind, then the causal and the inferential chain from that to my subsequent belief that my mind has this vast, normally unrealized potential is very direct, right? It's not totally immediate. Still inference is involved and representation is involved, but it all takes place within a couple of fairly trivial steps entirely within my head. So that's my thought is, yeah, it's kind of the length of the causal and inferential chain or something like that. Yeah.
Cool, thanks. Yeah.
Thanks.
So the next question is from Iñaki.
Oh yeah, thanks, Chris. Your description of knowledge that in terms of how it was self-reported by some of the people engaging within the trial is pretty interesting. From what I gathered, there seems to be this distinction between, let's say, an extrapolative belief, as in like something that you could extrapolate just beyond the direct experience of the actual psychedelic-induced state itself, into something that might be what I would consider as intersubjectively helpful, as in like you extrapolate towards something, towards some, say, truth or proposition that other people could have reasonable epistemic access to. However, this seems to contrast to, I think, the main feature of belief or knowledge that is present within a psychedelic state, which is belief that is directly related to the experience itself, something that is not intersubjectively accessible unless you actually engage within the, unless you actually ingest in some way the psychedelic itself. So I'm wondering, as in like within these, within the literature, what would be the proportion of like the certain types of beliefs and knowledge that have been reported? Are they more like extrapolative, or are they more so, let's say, just solely subjective?
So could you give an example of the solely subjective type of what you're actually talking about there?
Oh, in terms of like, let's say, a solely subjective of, let's say, I experience this feeling of oneness, or a descriptor, no matter how fallible it is, of some sort of transcendent feeling. And maybe an extrapolative belief would be, therefore I think God exists, or something like that. Or that therefore there is some hidden truth of some past self that I extrapolate from experiences of my past self in the psychedelic state.
Yeah. So I sort of get it intuitively. I'm still not clear exactly how you're drawing that distinction, because obviously if you talk about like the oneness hypothesis or the existence of God, these are also things that people can debate in kind of a, you know, you don't have to have a psychedelic or a mystical experience. These are still propositions that people can debate the arguments and evidence for. But it doesn't matter in a sense, because the short answer is there's not a lot of quantitative evidence. I mean, this issue of specific belief change and the epistemic profile of the psychedelic state is something that is really only starting to be probed experimentally now. So there's been a few papers coming out about it, and there's one study that I've been sort of involved in looking at, you know, do psychedelics change people's beliefs about the mind-body problem? Do psychedelics make people into idealists or dualists or physicalists or whatever? But none of this stuff is, you know, there's one or two studies from back in the 60s showing that you tend to get increases in agreement with statements about, you know, awareness of an ultimate reality or something like that. But in terms of rigorously charting the different sorts of knowledge that people claim to have gained, there's not a lot of quantitative evidence yet.
Okay, thank you very much.
Thanks.
So the next question is from Bessie.
Thank you, Danny. So I'd like to know whether there is any evidence that there are long-term, as in longer than 3 months, epistemic benefits. And I'd also like to know how you deal with the evidence of long-term epistemic costs.
Yeah, evidence of long-term epistemic benefits. Well, I mean, if my arguments about propositional knowledge are true, then I presume that's good. I mean, this is not evidence. This is me waving my hand and saying I presume. But if you discover some fact about your own mind under psilocybin, then I presume you're not going to forget it after 3 months. I think analogous remarks apply to knowledge by acquaintance, right? These sorts of discoveries that, you know, my unhealthy emotional habits as an adult develop, you know, stem from this event in my childhood, or wow, my mind has way more potential than I normally realize, and my sense of self is far more plastic than I normally realize. I mean, the vividness of them might fade, but I presume those insights are still probably going to be there in the long term. In terms of quantitative evidence, no, not really. As I say, this is still just an emerging area and not a lot of quantitative research has been done. And when it comes to the sort of knowledge how I was talking about, the mindfulness related capacities, no, that has not been studied yet beyond the 3-month point. So, I mean, you know, one thing that's interesting, I would expect that to fade. I mean, I wouldn't think from a single psychedelic experience you're going to have significantly elevated mindfulness capacities lasting much longer than a few months. I would be very surprised if they persisted significantly at a year. But interestingly, one recent study that showed significantly elevated mindfulness capacities at 3 months also showed significantly increased openness to experience, one of the big 5 personality traits at 3 months. And an earlier study showed that remaining significantly above baseline for up to 14 months after a single experience. So it's not out of the question. But yeah, evidence to date is thin on the ground. Yeah. Sorry, I just realized I didn't answer the second part of your question. Long-term epistemic harms, yeah. Well, yeah, I mean, the evidence there is mostly anecdotal, right? Again, it's not something that has been studied in a great deal of depth. It looks, basically what we're seeing from the last 30 years of controlled research suggests that the epistemic risks as well as the psychological ones are lowered. So they do long-term follow-ups in all of these people, and you know, you could raise concerns about researcher bias and so on, and I don't know to what extent these things have been addressed explicitly, but there aren't reports of people becoming, you know, at the kind of 12-month follow-up or 2-year follow-up after their psilocybin treatment. There aren't lots of reports in the papers of people becoming conspiracy theorists or kind of, you know, embracing outlandish belief systems. But I think this also, you know, the epistemic opportunities and risks, I think, are both things that are empirically understudied and need urgently to be studied more.
So we're sort of out of the official question time, but we've still got like about 2 or 3 minutes before the next talk. So Kale, you could ask your question if you like. We just might have to cut things off in a kind of crude way at the end.
Yeah, thanks. The talk was really interesting. And so my question, in your talk, it seemed like there was two broad categories of epistemic benefits. There's like the kind of circumstantial or capacity-based facilitation epistemic benefits, which kind of allow people to have certain kinds of epistemic success. And then there's the more kind of direct experience-based type of epistemic benefit. So I've kind of got a question about that second type. Specifically, you mentioned that there are a lot of distorting influences involved in the experience. So I wonder if like a reason to be skeptical about the possibility of experience-based epistemic benefits is that there are just so many defeaters in play, right? So it's like you're in Barn facade country or whatever. You know, there are just so many distorting factors in play that it's always rational to have a higher order kind of belief in that defeaters are in play. So even if later on in therapy you kind of hash something out, maybe what's doing the real epistemic work is the kind of interpretive process afterwards, if there's any kind of any epistemic benefit at all. So yeah, just what do you think about that kind of argument?
Yeah, good. So I take it you're talking specifically about propositional knowledge here, like the sorts of psychodynamic insights I was talking about.
Yeah, yeah.
Yeah, yeah. Look, I mean, one thing you can say is that psychedelic experience is the context of discovery, and then the integration sessions afterwards are the context of justification, because people definitely come up with putative insights through these experiences that they wouldn't have come up with otherwise. And I think that clearly is an epistemic benefit if some of those putative insights end up being legitimated as actual insights. But the other thing is just that I think, you know, and as I say, I do think this is tentative and provisional, but I think there are theoretical grounds to think that when it comes to introspecting psychological facts about one's own personality and motivations, we've got reason to think that psychedelics are beneficial more often than not, right? So I think this is why I think you need to kind of parse the different aspects of the experience and to come up with a total picture of its epistemic profile, both risks and benefits, right? So yeah, it's no good for learning about the you know, spatial distances and temporal durations, and in general, it doesn't improve the accuracy of your perception of the external world. But I think both the theoretical perspective that I outlined earlier based on predictive processing, and also the fact that it seems robustly to increase these mindfulness related capacities, and there's good evidence that mindfulness can promote more accurate introspection. I think there's a good case for thinking that, you know, while it's not perfect, the effects of psychedelics, especially in these kind of controlled conditions, in terms of introspection, one's introspection of one's own psychology, one's own emotional factors and beliefs and so on, tends overwhelmingly to the positive. It tends more to the beneficial than to the detrimental. And so that would be a way of doing it, is to parse out those different aspects of the experience.
So we're going to have to finish things there and start with the next set of sessions. But I'd just like to thank Chris for presenting this great talk today. And yeah, and thanks everyone for the questions as well. So we'll be starting the next set of sessions if people want to go into their streams. But anyway, yeah, thank you, Chris.
Thanks very much.